Hi again, I'm Dave Woolley from HypnoFocus. When people find out I'm a clinical hypnotherapist, the first thing they ask is, what sort of conditions do you treat? That's a very difficult question to answer because the patients that come are wide and varied, and each person has a particular difference about them. So there's something unique about every client, and that's what makes the job so interesting. I suppose the things that we do mostly are certainly weight loss, the treatment of fears and phobias, spiders and frogs or snakes or heights or flying. But perhaps one of the other areas that I have a particular interest in is people who are anxious in social situations, say social anxiety. What tends to happen to people is that they find that they're anxious in certain situations, so they actually avoid that situation. Then if that situation occurs again, or they feel that they have to do that, they become more and more anxious. And what tends to happen is that they start to do less and less, and their world becomes smaller and smaller because they're avoiding those situations. This can be even something like going for a meal with family or friends. And interestingly, this doesn't happen to people as they become more mature in years. This is happening increasingly to younger and younger people, and only recently I've treated people in their early teens and early 20s. So it's a very significant problem, and hypnotherapy is absolutely superb at helping them overcome that. Perhaps a slightly more exaggerated version of that would be when someone says they have panic attacks. What happens there is the person becomes anxious, or they imagine they're going to be anxious, so they avoid the situation. That makes them feel okay. When they're actually forced to confront a situation, they think something terrible is going to happen. They think they're going to have a heart attack, or that they can't breathe, or that they're going to pass out. And then they worry that other people will judge them negatively. So they avoid those situations, and this can lead to significant problems. People go out less, they'll avoid situations less. Hypnosis is a very useful intervention. We have a certain strategy that we can use. In fact, we have 2 or 3 different strategies that we can use. And I've worked with patients with anxiety and panic attacks for many years. If you know someone or you suffer yourself and would like to talk to me to find out how hypnosis could possibly help, then please give me a call. The number's on the website, and I'll be happy to spend some time on the telephone and answer all your questions. So if we think we can help, please give us a call here at HypnoFocus. Thank you.